Well, good morning, Dr. Ashley. How are you doing today?
I'm doing great. How are you this morning?
I'm doing well. This is another exciting episode of the Keeping Ashland Healthy podcast.
Yes, it really is.
We have got a news article that is it's starting to break everywhere. Doctors give kids ADHD drugs for adults' convenience. This is by Joy Pullman, and she's writing the article based on this upcoming piece that, again, not everybody maybe has access to because it's behind a paywall. It's been referenced a few radio stations I listen to, some podcasts I listen to, news podcasts are talking about this piece. It's getting a lot of I think the controversial title and just the issue. Mm-hmm. I think all of us know, whether it's an adult or a young person that might be struggling or been diagnosed with ADHD, it's just so prevalent and so commonplace. I think that's why there's such interest in it.
Yeah, that's interesting. I was actually surprised to see that it was on such a big news article, because we talk about this stuff all the time, but for it to be in the New York Times, that's pretty cool.
Right. So Paul Tough, Tough, is the one that's going to be doing the article in New York Magazine. But Joy Pullman is the author that we're going to be quoting and reading from, who is, again, talking about the Paul Tough article. One of the things she starts out by saying is just the scale of the issue. Nearly a quarter of 17-year-old American boys have a diagnosis of ADHD. And that's more than triple than what it was in the mid-'90s. So we've seen a rise. I think particularly this came out during the pandemic when I think there were even shortages of some of the medications that are used to help folks that are struggling with ADHD. But one of the quotes that got me was, quote, from 2012 to 2022, the total number of prescriptions for stimulants to treat ADHD increased in the United States by 58%.
10 years, 58%.
Yeah.
That's astonishing. Yeah.
In 2012, Americans in their 30s were issued 5 million prescriptions for stimulants to treat ADHD. A decade later, that figure had more than tripled, rising to 18 million prescriptions for stimulants.
Wow.
So, and again, if you don't know, stimulants are the primary psychiatric or medical intervention to assist those that are struggling. But the trouble is as we've talked on other podcasts, the ADHD diagnosis, like all other psychiatric diagnoses, are not based on a brain scan or some kind of blood draw. These are symptoms of what we call clusters of symptoms. In our diagnostic process, in our DSM, Diagnostic and Statistical Manual, is set up that way. So we look for clusters of symptoms that cause more or less impairment in the person's what we call daily functioning. And that's primarily how we diagnose symptom clusters. And again, that for maybe someone in the audience, they don't know. They think there might be a scan. There might be some kind of measuring of chemicals in the body.
Genetic testing or something. There's nothing like that.
And there's nothing like that. So that's always a challenge, because when we see these kind of increases in so-called diagnosis Z's, we wonder how much of this is really something that's real, biological, versus something that might be psychological or sociological or some combination of the two.
Right.
So Tough, in his article, supposedly goes on to talk about some of the negative effects of the amphetamines, particularly Ritalin and some of these other amphetamines. And he looks at a lot of the studies and says, there's really not a lot of difference between young people with a diagnosis that are medicated versus not medicated in terms of learning, ability to learn, et cetera. But he did note that the studies seem to indicate that a lot of folks on the Ritalin, it could retard the children's growth, impair their growth, so making them shorter. And that was obviously alarming, because obviously if it's doing that, if he's right in that, then what's going on with the medications interacting with the developing young people, that their growth would be in some way retarded, and they would not be as tall as they otherwise would have been.
Yeah, it's scary, really.
I would say so. So again, kids with ADHD often have other problems. So they noted in the piece here by Joy Pullman, 1/2 of Americans now take a prescription drug, according to the CDC. Often chronic conditions cluster, which is true of ADHD. Among children with current ADHD, 78% had at least one co-occurring disorder, meaning these diagnoses that whether it's adults or kids get, it's usually not the only one. So it'll be ADHD plus depression, ADHD plus some kind of anxiety, ADHD plus you name it.
Yeah. I think it's dangerous to medicalize symptoms like that. So we've talked a lot about root causes.
Yeah.
If you're looking at a behavior that a child is exhibiting, like their anxiety.
That's okay. One of the quotes here, Dr. Ashley, is they say far too often teachers, pediatricians, and parents are quick to medicate away the symptoms rather than deal with the underlying emotional issues.
Right. That's so true. So you see the symptom, you have to be careful about labeling that without understanding where it's coming from.
Right.
So if a child's afraid of something, I mean, that's an appropriate response.
Yes.
Anxiety is an appropriate response.
Yeah. They say that, Dr. Responding with anxiety to distressing situation is not disordered.
Yes.
It's appropriate.
Exactly. Yeah.
Yeah. And I think that's one of the things I think we want to highlight with our listeners. When you're thinking about going to a pediatrician or counselor, whoever, think about what's going on in the home, in the young person's life. I always go back to grief because I think that's one that a lot of people can understand. But this would be the case if it was maybe a divorce or some kind of marital struggle. Whether the young person loses a mom, dad, brother, sister, grandma, grandpa, pet, we would expect some grief and loss, and we would expect some kind of impact on the individual. Same thing if mom and dad are going through marital strife or a divorce. We would expect some types of symptoms that are different. And what can happen occasionally is folks can too quickly not see that as a normal reaction to these situations, but see that as somehow is abnormal and worry to the extent, and then they end up going in, and sometimes, unfortunately, Dr. Ashley, a professional will agree with them and then start to give them a diagnosis or even medications in some instances for things that were actually quite normal and quite typical, and the reaction they were having was very normal given the circumstances.
I really like that example because grief, I think people get maybe you shouldn't medicate grief because it's a normal reaction. So it's kind of the same thing that we're talking about here. These could be symptoms of things happening in the kid's life, not necessarily something you need to medicate away.
I agree. Well, and Dr. Ashley, I should say, this is not new to us at the Mental Health and Recovery Board. So many years ago, we started to fund an ADHD alternative through one of our contract partners, Appleseed. So this will lead us into our 3 great programs for this week. And one of those is just that. We're intentional in naming it. It's basically, again, an ADHD program, but it teaches all the alternatives. So folks would sign up, be interested because maybe they're concerned, either a teacher or the parent is concerned that perhaps their son or daughter might be struggling with ADHD. They can talk with Appleseed folks, and the program is not what you necessarily would think. A lot of it is there's work done with the parents, and there's work done with the children, and then there's work done together. So there's a peer component to it. And there's the professionals basically helping them figure out just what we said. What's going on in the home? How can we better differentiate between some of the changes and maybe how those might be related to some of these more of these sociological situations rather than anything quote unquote medical. So the whole idea was to reduce the number of young people that are on medications because of some of the behaviors that seem to be concerning to one or more parents.
Yeah, I thought it was ironic, too, the timing of that. When you guys I wasn't here in 2012, but it said in our annual report that program started in 2012, which is when that article is talking about from 2012 to 2022, just that huge increase in prescription for ADHD. Yeah. So it was well-timed, and it kind of,
you make a good point, Dr. Ashley. The board started it because, more and more often we were hearing about these concerns from parents in schools about everybody, quote unquote, everybody's got ADHD. And we knew that wasn't the case, but we wanted to take seriously the concern. So this was kind of this mechanism, this program was a way to kind of help differentiate between folks that are just having behavioral struggles, not because of any quote unquote diagnoses, but because circumstances, maybe it's bullying, maybe again, it's loss, maybe it's things going on in the home, maybe the youngster's got other legitimate medical issues going on that might be interfering. Maybe they need glasses, maybe their hearing's not so, there's all manner of things that it could be, but we wanted to institute a program that could help differentiate between everybody just being labeled and medicated, because at that time, back in 2012, as the article says, and as you just said, it was starting to increase. And unfortunately, Dr. Ashley, as you can tell from the stats that this article references, it's continued to grow.
Yeah.
And one of the biggest trends, and you may have seen this at the college age and beyond, is, all these diagnoses of young people of ADHD, guess what happened once they turn 18? All of a sudden, we saw a corresponding spike in, wait for it, Dr. Ashley, adult ADHD. So, all these folks, they didn't magically just stop, taking medications once they hit 18. But then we had this just incredible rise, and the article gets at this, in adult ADHD. So this ends up being then, according to some beliefs, a chronic condition.
Well, I mean, there's a lot of research about the effectiveness of the medication. So if you use a medication to treat ADHD, it's not necessarily working, right? So those people are aging into adulthood without getting, effective treatment for what's happening. So the ADHD program at Appleseed, this would be one. And again, this is for youngsters. We don't have an adult ADHD program, but we would maybe consider looking at that if there's enough of a need in the county. But for our young people, it looks like a series of groups. That's the way they set it up. So there might be 6 to 8 groups, and they usually do like 3 of those group cycles per year over at Appleseed. We'll link to all the numbers, but again, if folks want the Appleseed number, it's 419-281-3716. So another program that the board funds, and this one is through ACADA. We've talked about it a few times before, Dr. Ashley, and we even had some of the practitioners in. Over the summer, I guess it was the prevention, K through 12 prevention programming through ACADA. Yeah, they're great.
They are. They are primarily in K through, I would say, 9. They don't do maybe as much during the older grades, but they do some. But what the prevention gals are doing, and I say that because they're all women at this point, and I think we've just recently expanded to 4. They're in all of our school systems here in the county, and they're really trying to help build skills in our young people such that using drugs, alcohol, tobacco isn't something that they turn to. And they develop skills like, how to have better relationships with their peers, with adults, how to talk about if they're struggling in any area. So it's a broad base. The curriculum they use is too good for drugs, but it teaches them all kinds of skills that help prevent not only alcohol, tobacco, and other drugs, but maybe mental health issues, bullying issues, and even, dare I say, ADHD, because as they're developing healthier ways of talking about what's going on with them, like let's say they're being bullied, let's say they're upset with something going on in the classroom, the more they're able to talk about that, because they've learned that talking about their emotions and their feelings is actually a good thing, is a healthy thing, and talking to trusted adults and forming a relationship with trusting adults is a good thing. It might prevent more than just alcohol, tobacco, and other drugs.
Absolutely. So I looked up Too Good for Drugs just to see kind of the details details. So it helps them develop skills for making healthy choices, building positive friendships, developing self-efficacy, communicating effectively, and resisting peer pressure and influence. So you can see how those things in itself, those things can help prevent, yes, substance use, but also a host of other things, right?
Absolutely. So, and again, want the audience to know, Dr. Ashley, about prevention services in Ashland County. The board has always tried to front load, if you will. We have very limited funds in the county. We're certainly blessed with a levy that comes alongside some state and federal funds that we receive, but we've always tried to front load those dollars in the prevention categories. And the thinking is then, if we can do a good job with prevention, hopefully we won't need as much of the dollars being invested in treatment and crisis services if we're doing a good enough job with prevention.
I think that's so wise and such a good thing to invest in. Yeah.
Well, I think our board has been committed to that for going on 25 years now.
That's awesome.
So the program there at Acada, the school-based prevention program, parents really don't have to do anything per se. They're going to get that unless they opt out of that or they tell their teacher at the beginning of the school year that they don't want their son or daughter receiving those services. It just happens throughout the course of the year, and Acada provides that in the schools. They don't have to go to Acada to receive those services. But if there are questions that folks have about the program, please just call Acada at 419-289-7675. And again, this is the prevention services that the board funds through Acada. And very excited about those because, it's not just, as we said, alcohol, tobacco, and other drugs. It's other situations like ADHD that can be averted.
I just want to say before we move off of that one, over 4,000 youth last year were impacted by those prevention services. And Rick said in a meeting the other day, Rick Ford, the director of Acada, he said he anticipates between 4,000 and 6,000 this year. So, that's amazing.
No, that's good for folks to hear that are listening. Chances are, so if you have a young person in the Ashland County school systems, any of the districts that they're going to hopefully benefit by this program.
Yes.
Yep. Well, last but not least is, again, related to our opening article around ADHD is services the board funds through Catholic Charities. And these services, we call them Healthy Kids, Strong Families and the Family Resiliency Program, but they've really blended into one program. And it's pretty much how it sounds. The idea is if we can build healthier kids and stronger families and help build resilience within families, again, the need for psychiatric medications or diagnoses should go down. The idea being if our families and our individual young people are more resilient and they have more tools in their toolbox to deal with, again, whether it's talking about family issues, financial issues, it could be struggles academically at school, bullying, loss, all these things. As this program through Catholic Charities helps families build skills, abilities, and resilience as a family and as individuals, they're in a better position to avoid, some of the impacts of life.
Yeah. I love that they consider the parents and the family too. Yeah. So it's not like, here, this is my kid, they have the symptom, medicate it.
Yes.
But how can we help that family and actually get to the root cause of that?
Yeah.
So I love that.
I think that's important. And all our programs, this idea of an identified patient being the child, pulling the child, seeing the child out of the context of the family, our contract partners, Acada Appleseed, Catholic Charities, they don't do that. And I appreciate that. That is an emphasis of ours at the board. Whenever you look at behaviors outside of the context, which is really what that article was getting at. We just, and sometimes we diagnose symptoms outside of the proper context, and what can happen is mistakes.
We misunderstand them.
Yes.
Yeah.
Yes.
Yeah.
So we misunderstand what's really going on. And I just ask everybody, whether you're a professional practicing as a counselor, social worker, MD, I don't care. I mean, context is king. We say that sometimes in my biblical studies, but context is always king. So whether we're talking about symptoms of a young person, symptoms of an older adult, or symptoms of middle age, I don't care what the age is. what is going on for that individual. Yeah. Dr. Ashley and I do quite a bit of suicide prevention training in this community, and that's a key part of our training is understanding if somebody's distressed, there's a reason for that distress. We don't want to start leaping to conclusions, but we know that it could be something financial, it could be social, it could be, you name it, medical, but there are reasons why folks are maybe acting the way they are.
Yeah. And if we are just treating symptoms, we're probably missing what's really happening, and we're not going to be effective in helping, which is the goal, right? Yep.
We are a trauma-informed system here in Ashland County, and part of that is asking, again, not what's wrong with you, but, tell me, what's happened to you, what's happening to you right now, tell me more about your story. And when people start to tell about their story, which is just a fancy way of saying what's going on, right? Tell me the context. Tell me more about what's going on right now. And when we insist on learning that, I think you're right, Dr. Ashley. We have a much better chance of getting to what's really happening and avoiding misdiagnosis, treatments that aren't effective. And as the article says, there could be some real harms. There's some additional challenges when somebody takes amphetamines for long periods of time. There's some heart issues. There's some other issues that are related to that. So we just don't want to go down paths that we don't need to be going down, because sometimes there are impacts, and getting off of some of these substances is easy. And we've talked about that in another broadcast.
Yeah, can do a lot of damage.
Yeah. Well, so there you are. There's the article by Joy Pullman, and then there is the 3 great programs that the board funds at the Mental Health and Recovery Board. We will have links to all of these things. The Catholic Charities number is 419-289-1903. If you have questions about their Healthy Kids, Strong Families, or Family Resiliency Program, you can always reach out to them. The folks, Cheryl Villegas and her staff, are wonderful. We will have all this in the episode description, Dr. Ashley, and just encourage folks to just ask questions. It's okay to ask questions of your doctor, your pediatrician, of your school people, of people that work in our system at Appleseed Acadian Catholic Charities, and it's even okay to ask questions of your local Mental Health and Recovery Board. In fact, people ask us questions all the time, Doctor, and we love it.
Yes, we do. Absolutely.
Well, thank you again, Dr. Ashley, for another great episode, and we'll be back soon with more information for our Ashland County community.
Yes, thanks so much for listening.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in keeping Ashland healthy.